Hi, I'm Jen, the kinda old autistic lady. If you've never seen any of my other videos, I am a late diagnosed autistic individual who was diagnosed basically last month. So I'm in my mid 40s and I am a sober alcoholic of 3 years. Today's topic is my experience with unexpected medical complications during the rehab process. So a little bit past the detox process, but into the rehab process. I need to give a disclaimer, however, that I am not a physician. I'm not an addiction professional. I am only an individual alcoholic who is also autistic. And so if you are thinking of doing any kind of quitting cold turkey or any sort of program to stop drinking or using, do talk to your healthcare provider, do talk to an addiction specialist, because they're going to be able to help you to know what's safe for you. With that said, if you haven't seen the other video on medical detox, I highly recommend that you watch that first before this one, because in the grand scheme of things, that one's more important than this one. In fact, for all the addiction videos, in my opinion, that I'm going to make, the first video is the most important about medical detox. However, I have talked to some other autistic folks who did not do a medical detox, who also had some of these same symptoms. So know that it's not just me. Know that if you are addicted to a different substance, that your surprise side effects could be different or could be non-existent. But this is my experience, and I wanted to share it, especially because I think a few of these are specific to being middle-aged and not being a younger person at the time that I went through rehab. So a little bit about my background, if you didn't watch that video or if you watched only portions of the other one. So about 3 years ago, in November of 2021, I was a very heavy drinker, and I entered into a facility that had a medical detox program, and then I stayed inpatient at that same facility for approximately a month. And then after that, I did what's called an IOP. It stands for intensive outpatient. And I did that for a couple more months before then kind of being on my own, so to speak. So what I'm talking about right now, if your background isn't exactly the same as mine, you could potentially have some of these side effects and not know it until it happens, and might not potentially be in an inpatient setting like I was. It wasn't like a hospital where I was. It was more of it was an addiction center. It was a recovery center. So we had a lot more freedom to move around and talk to people and do things and go outside and that type of thing than you would have in a hospital setting. However, I want to share that, number one, I was totally shocked that these 4 things happened to me. If someone had told me that they were going to happen to me, it would have scared me into going to rehab, but I would have wished in the long term that somebody had told me, because they could be really dangerous if I had just stopped drinking on my own and not been under direct medical care inpatient at the time that they happened. So if you don't intend to go to a facility, but you do intend to quit drinking or quit using, know that there may be a domino effect on other things that are going on with your health, and that you really do want to stay in touch with your primary care physician or general practitioner, as well as any other specialists you may see. So the first thing I want to mention that I went through that would have been a totally silent thing had I not been under medical care is when I stopped drinking, my blood pressure shot up, and I had to be put on blood pressure meds for the first time in my life. And what was explained to me is that alcohol will lower a person's blood pressure if used over time and in excess. And so it basically been like I had been taking a blood pressure medication, but instead it was alcohol. And so remove that, and I needed blood pressure meds. Now, some of that could have been my weight at the time. Some of it could have been the fact that I was middle-aged. Could have been both. Could have been family history. I really can't tell you exactly, but if I hadn't been under the care of a physician, I might never have known that. And of course, if you have high blood pressure that's untreated for a long period of time, that can lead to other problems. The outward sign of it, though, the thing that was noticeable that kind of went along with it, was I immediately had really bad edema in my legs and feet, to the extent that I had to basically spend almost the entire month, every time I sat, my legs were up on a stool with my feet above my heart because they just ballooned. And that had never happened to me before, even when I was in periods where I hadn't been drinking much or at all. And it shook me because it was really uncomfortable, and it was kind of embarrassing because I was the only one who had gone through that. I will say that one nice side effect is that when I stopped drinking, within a few months, I lost 40 pounds like that, because I had been consuming so many alcohol and sugar calories in addition to binge eating, that part was great. But the edema and blood pressure piece were just a huge shock to me. The last one I'm going to mention that I'm not going to spend a ton of time on compared to the last one is vertigo and nausea. And I had a history of vertigo prior to this. I already had a neurologist prior to it. I had vertigo migraines, but what I experienced was nothing like any of it. If I went to take a shower and I tilted my head just a little bit to wash my hair, I would throw up, get really sick to my stomach, and the room would spin. And I had a few instances where I took a few tumbles because my vertigo got so bad. And that was treated after I left the facility. It was something that they kept a really close eye on, and it got bad enough that they actually sent me to the ER and gave me an MRI to make sure that I didn't have something else really serious going on that would have necessitated a higher level of care beyond that setting that I was in. And the MRI was clear. But I mean, it was bad. I just, I have hygiene issues anyway, where I have to really force myself to do it. And I had been sharing a room with 3 other women and sharing a bathroom with 3 other women and trying to take turns taking showers and whatnot. So then you add the fact that I knew I was going to feel awful as soon as I tilted my head back or moved it to the side. It was not cool at all. So one of the first things I did when I got out of the inpatient setting was I went to my neurologist, and he prescribed physical therapy. And I've had several people in my family who have had vertigo issues, not just me with the vertigo migraines. And what I assumed was the thing with the crystals. If you've ever heard of that, basically you've got these crystals in your ears, and a physical therapist can tell if that's the cause because your eyes do this thing called nystagmus, where they sort of like move involuntarily really fast when they do certain things to you, to diagnose it or to at least see what the effects are when they do those things. And they did that to me, and that was not the cause. And what the real cause was, the way the physical therapist explained it to me is some long-term alcoholics basically having alcohol in your bloodstream over time for a long period of time at high levels can change the viscosity of your inner ear fluid. And so when I stopped drinking through that medical detox and all of a sudden didn't have any alcohol in my system at all, my brain wasn't used to the signals it was getting because that viscosity was kind of thrown off. And I've talked to a few other alcoholics I'm not even going to say they're alcoholics, a few other autistic folks who decided to stop drinking Their drinking wasn't as bad as mine, I don't think, where they had to go inpatient, and they still experienced this and didn't know what it was. And so for me, what happened was I did physical therapy where the sole purpose of the physical therapy is to get my brain to understand what my eyes and ears were doing. So it involved a lot of things where like I would have to look at a dot on the wall and move my head different ways for like 5-10 minutes at a time. And then she'd give me something else. And not going to lie, there were a few things she had me do that I about turned and upchucked right there, because I was, it took a while. This physical therapy did. But at the end of the day, it's mostly gone. Once in a blue moon, I still kind of get like that, but I don't think I need to go back to physical therapy. I think it may be tied to the fact that I have vertigo migraines and take medication for that. So if you ever experience anything like that and you stop drinking, talk to your physician. I don't know if other substances have those 3 side effects because I'm not a doctor. But those are the 3 that I want to talk about that are not alarming as they were. This 4th thing I'm going to mention is the thing that every single time I have a craving for a drink, I remind myself about. And it is the thing that scared me the most. After I detoxed, and if you watched the other video or didn't watch it, basically what they did was they gave me benzos for a few days. And I didn't have a problem with benzos prior to that. No addiction issues with them. No other medication interactions with benzos. So they basically gave me Xanax. I think it was Xanax. I'll have to look that up now. It might not have been. Is Xanax a benzo? Whatever it was one of the drugs that like mellows you out. Valium. It was Valium, not Xanax. It was Valium. I'm not even sure I've ever taken Xanax. I don't know why Xanax popped in my head. Valium. They gave me Valium for about 3 days as part of the medical detox process. Don't try it at home. Let the addiction professionals help you with this. But after I finished with that, I have no way other to describe this other than my short-term memory completely went away. Completely went away. Huge pieces of time I lost. To the point that I was constantly, every time I was around people, reintroducing myself to them at this treatment facility because I didn't know that I knew them already. And if we were in some sort of a session talking about a certain topic, they would say something and 45 seconds later, I'd have no idea what they were saying and was totally confused, which was very uncharacteristic for me. I was a functional alcoholic before this happened. I had been working the whole time and had an office job where, I had to use memory. I mean, it was definitely a thing. I had to use my short-term memory in order to do my job. But as soon as I detoxed, I had this memory deal go on. And it took a long time to come back. It happened slowly over time. About 2 weeks later, I wasn't quite introducing myself to people anymore and asking what was going on because I wasn't remembering it. I was putting things together a little bit more. But with that said, I took a little bit of a after the inpatient section of my recovery time that was about a month long, I actually took about another month off from work because my short-term memory was still bad enough that I didn't think I could do my job. And there are other videos that talk about this, but in case you haven't seen those, my background at the time that this happened, I was a contact center quality analyst for a multinational organization for their internal contact center. So literally what I did for a living was listen to other people talk and then evaluated them on it and help them to get better. So I knew that I could not go back to doing that kind of work, because if I made mistakes because I couldn't remember things due to the short-term memory issue problem, that I could be messing with people's livelihoods if I was like scoring them down for not doing something that they clearly did and I couldn't remember. So it was still bad enough after that month that I knew that I needed more time off. And between the vertigo issue and the memory issue, after I got out of rehab, y'all, the day after I got out of rehab, I was diagnosed with having both COVID and strep throat at the same time. And this was back when COVID was still kind of scary. People were still masking. It wasn't at the height where, everybody was totally isolating. But for unrelated reasons, I had gone to a sober living facility due to some construction that was going on in my house. And I was going to do that as a short-term thing to not be around all the dust and everything because I have asthma. And y'all, I was there for less than 12 hours because I found out I had COVID, and it was like, nope, you can't stay here. I mean, it was still kind of in that scary phase. So I then isolated for 2 weeks, and it wasn't a whole lot after that I found out that I really needed to get home because my brother was dying. I mean, I knew he wasn't doing well the whole time I was in rehab, but it got down to the, no, he's like, get here kind of a thing. And I couldn't do it. There was absolutely no way, because where I live in Tennessee and where my family is in the Midwest, I would have had to take a plane from the Nashville airport to either Chicago O'Hare or Atlanta, and then take that plane to my hometown. And because of the construction at my house and having cats and all these things, my husband had to stay back. And so I knew I couldn't basically let him be my eyes and ears and memory. And I knew that I couldn't get into Chicago O'Hare and look up at the board to see what gate my flight had to go out of and basically pass out and vomit right in front of everybody because of the vertigo thing. And I wasn't convinced that I would even remember where I was, why I was there, what gate I was trying to go to, what time it was supposed to be, that I had put my ticket in my purse. I mean, that's how bad this stuff still was after getting out of a month of rehab. And about a month later, I was good enough. And even after that time period, my brother did pass away, and I was able to go back for his funeral. But I basically had to get a wheelchair so that they would take me from gate to gate. Doing it that way, I was good enough that I could make it there for his funeral. But I had no idea that it was going to shake out like that. No idea at all. To the point that I just kept thinking, if this doesn't get any better, I'm not going to be able to work again. It was just, the memory thing was such a big issue. And I couldn't understand it. I'm a very logic-based person. I think a lot of autistic folks are. And I could not logic my thought process, and still can't to a certain degree, how I was functioning and doing okay being a functional alcoholic, in terms of I could drive from one place to the other. I wasn't having memory problems doing stuff like that. I was able to work. And when I eventually went back to work, I went back and checked all my old work to make sure it was good. And it was. I was functioning in terms of memory, not otherwise. I mean, that's why I ended up going to rehab. But from a memory perspective, I was not having that problem before I stopped drinking. But the brain, as I think most I can't speak. The brain, as I think a whole lot of neurodivergent folks know, is a pretty complicated thing. And I'm not saying that if you stop drinking that you're going to have these symptoms, because everybody's body is different. Everybody's health conditions are different. Your age, your genetics, the amount you are consuming. And if you are also addicted to some other substance, either in addition to alcohol or in lieu of alcohol, there could be totally different side effects that could happen from detoxing. And the biggest takeaway from this is be under the care of a doctor. If I had done this on my own, I would have really run into some problems. And the biggest reason was I hadn't been telling my doctors that I was drinking at all. I was a closet alcoholic. Nobody knew I was an alcoholic except maybe my husband. If I was in a crowd of people, if I was forced to go to some sort of social event, or if somebody invited me to go out for a lunch or something, I almost never drank. And if I did, I had maybe one because I knew I'd have to drive home. It was all binge drinking at home that was the problem for me. And I had been on several medications that I should not have been mixing with alcohol. I also have sleep apnea, and it was a very regular occurrence when I was drinking that I would pass out like in the chair or on the couch and didn't have my CPAP on. And with as much as alcohol can depress your breathing, like I was taking it with like muscle relaxers and stuff like that. Of all the medication I'm on, probably 70% of it you're not supposed to have with alcohol because the combination can kill you or give you seizures. And so I don't know how that didn't happen. If it did happen, I wasn't aware of it. And how I survived it, I really don't know. I think it's one of those things that you could take another person in the exact same situation and the alcoholism, they might have died of alcohol poisoning. I don't know what it was that spared me, but I was drinking to that level. I had days where I was easily drinking a handle a day. And so because of that, I hadn't told any of my doctors that I was drinking the way I was. None of them knew it. And to be fair, the reason I didn't is because when you're morbidly obese like I am, you're constantly getting told you have to lose weight. And it's such a big deal. And it is a big deal. Don't get me wrong. Morbid obesity affects the body in all kinds of not healthy ways. But I was really surprised after I got out of detox and rehab and then told all of my doctors that I had stopped drinking because I was expecting to be shamed for it, to be told, well, why didn't you tell me these medications I was prescribing to you could have killed you? Shame on you. And it was not the reaction of a single physician when I stopped. Every single one of my physicians praised me for doing it and talked about how it's so hard to do, to stay sober, to stay clean, and how it's important that I tell them if I start drinking again, because even though it's not good for me to drink again, they need to know it for like prescribing reasons and whatnot. But I did not get the reaction I thought I was going to get. And that was both through my primary care doctor and all the specialists I see for just other things that are unrelated to alcoholism. And if I could leave you with a takeaway, it's to be under the care of a physician and be honest with them. especially if you're going to stop using a substance. But don't be like me and not tell your physician that you're like drinking heavily, because it could kill you if they prescribe you the wrong thing and you're drinking and they interact and cause some sort of a problem, like a seizure or whatnot. And you're behind the wheel of a car when it happens. So, as I mentioned in the other video, these addiction videos are actually what I feel is the most important topic on this channel. I'm going to be making more videos. And if you didn't watch that other one, I just want to repeat, I am not a 12-step evangelist. I intend to talk about 12-step programs, but in a more of a what worked for me, what didn't work for me kind of approach. I personally don't go to AA. I did for a while. I don't anymore. And there are reasons for it that I'll talk about in other videos. So if you are not a 12-step person, don't feel like you're gonna get that in my videos, because you won't. If you are somebody for whom the 12-step program has really worked, feel free to come back to the channel, because it wouldn't surprise me if you maybe have other people in your orbit, because autism does tend to run in families, who may also have addiction issues, but for whom the 12-step program, either NA or AA, as a whole, may not work best for them. And so my videos might help with that. And then there, of course, are some people that are like right out the gate, they know 12-step program isn't for them. For example, 12-step programs are really big on having a higher power. And for atheists and agnostics, for example, it's a non-starter. And I will talk a little bit about what AA and NA will tell you about if you have those beliefs. But there's more than just those 12-step programs out there that I want to talk about. One of them is a program called Smart Recovery. It is not spirituality based. So I will talk about that a little bit, as well as eventually, if I get enough following on the channel, I really want to do some live streams where we can talk about addiction issues with each other and maybe do some unconventional things. I have no sort of licensure or formal experience or anything like that as an addiction professional. So if what you need is at that end of the kind of a linear sort of spectrum, I'm not the person for you. I'm more of an informational, here's what worked for me kind of a person. But I do think that there are things about the recovery infrastructure that are very difficult for autistic folks and neurodivergent folks, especially. So I do intend to tackle those topics in the future. And I'll break them up into videos. I'm not going to be doing hour-long videos on this stuff, because even this video is plenty long. But hopefully I was informative for you today. If you found this content helpful, like, subscribe, come back to the channel even if you don't want to like and subscribe. And I lost my train of thought. Y'all, I don't heavily edit these videos, and the reason for it is because even though I'm a verbal or a speech enabled person, I'm not so fluent in speaking that I never lose my train of thought or lose my words. And to me on this channel, for how my vision for it is I want folks to see when I get tongue-tied, when I get at a loss for words, what I do to come up with my words, because I have other videos that are communication tips and strategies. And part of what you see when I get tongue-tied, I have tips and strategies for that I can also share, outside of like my addiction playlist. So if you are somebody that is used to seeing highly edited, very polished videos of other autistic creators, some of those same creators are people that really helped me in my own journey to even seek an assessment to see if I was autistic. So I definitely think there's a place for that type of content, but it's not here. I'll edit things out if it's really, really bad, or if I'm not sure if I'm going to keep the Xanax thing in there because it it wasn't Xanax, it was Valium. Like that's a what's the right word? That is a talking about I'm leaving the stuff in when I get tongue-tied, and then I get tongue-tied. There's a very specific piece of terminology I want to material. It is a material difference when I use the wrong word like that. But I want to be real, and I'm going to do the best I can to not look too polished. And the same thing is going to be the case if you ever see a video of me and I have urges and cravings, I will tell you that. If I'm having a really low energy day, you'll be able to tell it because that'll come across. I'm part of masking for me always was acting like I had more energy than I did, and man, does that lead to burnout. So I think that's the end. Thank you for watching. Take care.